Welcome back. We're discussing the state of Canadians' mental health and what that looks like now, especially as we emerge from COVID. And joining me to have that discussion is Sarah Kennell, National Director of Public Policy with the Canadian Mental Health Association. So Sarah, obviously, with COVID, it impacted everybody very differently. If you were a teenager, you probably would have been very upset with some of your programs and schooling changing, never knowing kind of what's going to happen from day to day. If you were someone infirmed or perhaps in an LTC, there was I would assume a lot of loneliness there. And then you have the parents trying to keep it all together, working while schooling. There was a lot going on. Maybe you could share with us how you saw different cohorts impacted in various ways during and post-COVID.
Yeah, absolutely. What we saw is really an exposing of gaps that already existed prior to the pandemic in terms of discrepancies in access to healthcare services and mental health supports in particular. So, the folks that we would consider to be marginalized prior to the pandemic, whether it be racialized folks, LGBTQ2 folks, Indigenous peoples, unemployed, people living with an existing mental health condition, they're the ones that we saw in our research to be most likely to experience a deterioration in their mental health as a result of the pandemic. What we also saw emerge during the pandemic was a real important focus on what we have come to describe as the sandwich generation. So parents who are caring for young children or school-age children, in addition to caring for aging parents. So as you mentioned, parents who are entering the long-term care or retirement residence situation and really having the double burden of having to care for people at both ends of the spectrum age-wise and not being able to see them in person or them being located in other geographic parts of the country. And that population has been incredibly impacted from a mental health perspective. We also don't yet know what the impact will be on our young generation. So people or children born post 2020 and the changing environment of socialization and childcare settings, we don't yet know what the impact will be. And of course, as you mentioned, with school age children and teenagers, those finishing up high school and applying for university, these are the populations that we're monitoring very closely. And we've already seen heightened levels of depression, anxiety, suicidal ideation, and eating disorders in particular.
Yes, I can say just from personal experience, hearing from friends and stories from friends of friends of suicides of children, young teens or later teens who've taken their life or who've, it's been a lot. And, I didn't think about mentioning this, but even surrounding the vaccine, I mean, it was a very polarizing issue for some Canadians. And, there were some Canadian students who elected not to procure or not to get the vaccine, for example. Well, they found themselves quickly de-enrolled. Their life kind of crumbled before them very quickly. I always wonder how that would have impacted. I mean, yes, I suppose ultimately it's a choice, but I can imagine that must have been hard for a lot of young college and university students.
Absolutely. And also challenging from a parent perspective when you're making choices on behalf of children regarding vaccines or masks. These are really difficult conversations to navigate among parents and among children. And so having the skills to be able to navigate those challenging conversations is really important. The theme for our Mental Health Week 2022 is empathy. So being able to understand where someone else is coming from and being able to put yourself in someone else's shoes. I think these skills are so important now, considering the divisions in society that we're grappling with. I think, empathy is really key for those conversations.
Yes, and I'm glad you brought up Mental Health Week. I should mention we're doing this show actually because of its Mental Health Week. So I appreciate that I know you're very busy, that you made time to come on to discuss this. Empathy, what an amazing theme for this year, because we've seen a lot of language and politics of division and a very us versus them mentality in the past couple of years. And it's important to kind of really understand, take a moment to pause and say, you know what, how can I understand where that person's coming from? And do we need to really have this kind of discussion so polarizing? Can we find a better way, perhaps?
Exactly. And it can be translated at so many different levels, whether it's the halls of the House of Commons or Senate, or just the halls of school or in our communities. We live in diverse communities that with people who hold diverse political views and other views, and being able to break down the barriers that are seen to divide us can be really helpful, particularly when we start to navigate the way forward. We know we're not returning to normal. We are creating a new normal. And if we're going to do that, we're going to have to work together, and being able to understand where we're coming from and to be able to put ourselves in other people's positions and try and negotiate what those common grounds look like, I think is the key to moving forward post-pandemic.